Here are some of the tools and the things that AI can assist you with in addition to content creation like ChatGPT. So there's a few different of these types of, content generation platforms.
The root of the word governance, that is of the verb to govern, can play a bit of a trick on you. In fact, I'm going to play it on you now. Is your medical group governed or governed? You see, the English word itself comes from a Greek root that means to direct, to rule, to guide, or to steer.
As introverts, we very much, instead of working the whole room, we prefer the one-on-one conversations, either one-on-one or in very small groups, because we really find value in having a deep, meaningful conversation, depth to that.
We can streamline things, and we will look for ways to, with tech, to make things easier for us. And we always want to be thinking about our customer, our patient. Everything is patient-centered. And I think if we just focus on those four things, navigating, using our skills, streamlining our actions, and being patient-centered, I think you'll find that it becomes very straightforward how to get through private practice and medicine in general.
In medicine, we're not accustomed to failing very often. Early in our career, if we were, we would probably not have made it through the training.
Going through medical school, you think you know everything, but then you really don't. And if you're going to say that I can use my skills as a physician for this startup or whatever it is that you want to do with it, be a consultant or write papers and be an op-ed editor or whatever it is that you want to do. You can't say, I went to medical school and so now I'm an expert. I could not do what I'm doing now without all those years at Sloan Kettering where I honed those skills and I learned.
We're no longer in the knowledge economy. We're now in the wisdom worker economy. And this has to do with the value of a physician in the age of AI. As I said before, there is no smartest person in the room. So your value as a physician, either as a clinician or as an entrepreneur or both, has to do with your judgment. We call it clinical judgment. And that's not something that gets paid for. It's not something that gets terribly rewarded, but we all know it's probably the most important competency of an experienced doctor.
They won't want to come in for anything. They want you to do everything over the phone and not ever come and pay. So it's very difficult to have two competing models.
Steve Jobs is notorious, and Apple is notorious, and very, very successful, obviously, for putting the experience of the user before the technology. And I think in the health tech sector, especially in entrepreneurship stuff, and there's a lot of opportunity in this space right now.
These are the things that I did. At one time, I had 7 streams of income. All right, I was crazy. I had my W-2 job. I had medical malpractice. I was working with industry, teaching, training. And again, it wasn't that I was doing anything different other than what I was trained to do. And all of my 7 streams of income, think about it, all related to medicine.
Put effort into something that is all yours. And I don't know what that's just something to say about that is very fulfilling. And so I say all of this because if you're thinking to yourself, gosh, I want to start something for myself. I'm interested in entrepreneurship. I have no idea what I want to do. My recommendation is to sit down and write out 100 things that you like and enjoy spending time with.
I'm going to present 3 ideas this evening. The first is healing reactivity, or responding versus reacting. The second is that your perception shapes your reality. And the third is that connection creates culture.
I saw a problem, I saw an opportunity, I saw a platform, and I offered my services to actually, as I call it, tropicalize or actually add jalapeno to the platform that they were creating. And it worked. And it was actually the first time that I had the opportunity to dig in an idea.
What are the advantages of using a market rate? Number one, it more accurately reflects what competitors and colleagues are charging, right? As opposed to reference-based pricing. Reference-based pricing, it doesn't have anything at all to do with what your competitors or your colleagues are charging, and so is not a reflection of the market forces, okay? And it's also easier to justify pricing because you're charging what other people are charging around town, okay? So let's say, you do an appendectomy, okay? You're a general surgery, you do an appendectomy, and charge the same amount that the guy down the street is charging, well, you could say, look, I'm not overcharging. I charge the same as Dr. Joe Blow. And so that's easier to justify in the eyes of a lot of people.